Hi, this is Dr. Sumithra, Pediatric Intensivist and a Pediatrician at Aster Women's and Children's Hospital, Whitefield, Bangalore. I'll be talking on fits, which is also commonly called as seizures in children. It could be quite alarming as a parent to see your child fitting or having a seizures. It's very important to know what are the conditions and what could be prevented from as a parent. The first aid can make a lot of difference in preventing the child getting into complications. So let's first look into what are the common causes. As a child, it still has a growing brain and the brain cells are quite immature, and they could have been see commonly in our emergency is the child coming with fever, and because of the fever the child getting into fits. So most commonly any infection which can cause fever, it could be either ear infection or throat infection, or sometimes it may be as simple as urinary tract infection, which could lead on to fits. This is more commonly seen in age group of 6 months to 6 years. So other rare causes or very severe causes could also be the reasons for your fits, which becomes very important to be assessed by a pediatrician. So it could be a severe infection in the brain, what we call it as meningitis. Brain infection also, the child can present with a fever as well as a fit. But most importantly, they could also have other symptoms like your child could be irritable, or child could be excessively crying as well. So if any of these symptoms are there, it's very important for you to show to the pediatrician. So next could be other causes, could be rarely we have seen that children may be having a fits problem where needs evaluation by doing either CT imaging or MRI, or sometimes the child also require EEG to just assess whether your child is going to get further fits. Sometimes this assessment make a lot of difference to prevent further seizures from happening. So this needs to be assessed by a neurologist. So other less common causes, especially in a very small child, it could be as simple as hypocalcemia, where the calcium level is low, or it could be sugar levels which are low. Sometimes we have seen children, especially if they are developmentally not well, like they have their like standing could be delayed. In the children, it may be related to the brain development, which could have caused into fits. So as we know, as I told you, it's like the febrile seizure is the most common cause. It's very important, like especially the first time you come to the hospital, to rule out other common causes, which I've told you, either brain infection or it could be simple as hypercalcemia. So let's go into how do you recognize a child, which is whether your child has a fit or not. So coming on to the most common thing which we see the parent presenting to our emergency is the child is shaking vigorously. The vigorously, it could be shaking all the four limbs, which we call it as generalized seizures, or could just involve one part of the body. It could be just the right upper limb or a right lower limb, which could be involved. So we call that as a focal seizures. So coming on to this, generalized seizures as well as focal seizures, sometimes even a very high temperature, the child could be shivering. It's very important to differentiate whether it is just simple as fever which is causing shivering, or it is a febrile fit. If your child is unresponsive at that time and vigorously shaking, it could be possibility of seizures are high compared to just simple because of the fever which is causing shivering. So other thing is the child could be just posturing, that is holding his upper limbs and lower limbs quite tight with arching of back. This we call it as like tonic posturing. This is also one of the form of fits where your child could be presenting only with the tightening rather than shaking. Most parents just can't recognize this. They think just a shivering or a shaking is the seizure, but sometimes it's very important that the parents do recognize that holding tightly is also one of the form of seizures. So other thing is the child can just have his eyes just going upwards or squinting, what we call it as squinting. Your child could be just uprolling of eyeballs without any other symptoms. If there is eyeball which has gone upward or is directed to one side and the child is unresponsive at that time, it could be the child is having your seizures. So it's very important to get to the pediatrician to differentiate it, your child is not having a fit. During this episode, child also may be having twitching of face, or sometimes there may be excessive salivation, drooling of saliva from an angle of the mouth, or sometimes the child could just pass as involuntarily, the child can pass urine or stools. So these are the common presentation the child can present when child is having a seizure. So any of these things are there, it's very important as a parent to get immediately to the hospital so that we could evaluate him for whether your child has a seizures and require immediate attention.